So thanks everybody for joining. I'm delighted to introduce today's speaker, Dr. Jenny Vanos. She is an assistant professor in the School of Sustainability and the College of Global Futures. Her research focuses on the effects of extreme heat, air pollution, on the health of vulnerable populations, such as children. She and her group are running a number of different field projects around the Arizona area and collaborates with schools, government, and nonprofits in community-based research. Today, she is going to share some of her work. Are you able to share your screen?
Yes, I am.
Awesome.
Thank you.
Well, whenever you're ready, take it away.
Okay. Let's see. Okay, there we go. Looks good. Okay. Well, thank you for the invite. It's really nice to talk to the CAP community. And it was nice for Marina and Dan and Mark and everyone to invite me to do this seminar. I got to email with Dan or talk to Dan a little bit to see what might be interesting, because there's a lot of different things I could talk about to this community, I feel like. And so I decided to go with kind of a big picture overview of things, but make sure I scale down into what I'm doing in the region, particularly in South Phoenix, and make sure I can highlight some of my work that is related to CAP or the RET work that I'm doing, so the research experience with teachers. So I got here about 2.5 years ago to ASU, almost 3 now, I guess. And but I was studying with people at ASU before that. And so it's fun to be at ASU. I think that what you're going to notice too in this talk is that it's hard to ignore a lot of the work that's been done at ASU and in CAP on heat and some on air quality to be able to understand what's going on, and especially in extreme heat research that's leading the world in terms of what we're doing with mitigation or working with our cities and communities. So it's a really exciting place to be for that. A lot of this work too I do with the Urban Climate Research Center and the Laboratory for Urban Climate Instrumentation that Dave Saylor runs, which is a university-led initiative. So for today, like I said, I'll be going global to local, but there's a little bit of zooming in and zooming out depending on the topic. I'll start with air quality and heat challenges more at a global scale and just the different vulnerabilities around that. But a lot of my more global thinking around heat or around these topics comes in extreme heat. I'm thinking about mortality projections. Local initiatives I want to discuss are around children's exposures to heat and air pollution and some mitigation efforts that are in place with that and a few case studies there. I don't know if Quincy's on the call, but of course Quincy and his kids get to make one of the first slides here because they were participants with us in a Tempe heat walk we did a couple years ago. And then the other picture there is a tree planting we just did on April 1st with our partner in South Phoenix at Paideia Academy. So just a little insight into some of the more community-based work I'll be talking about. But I like to give a little background about what I do or what is the lens I approach things with. And so I'm a human biometeorologist or a human bioclimatologist. That means I'm looking at weather and health or climate and health and the impacts of these atmospheric processes on human health. But I focus on temperature, sun exposure, what it means to bring greening or other forms of heat mitigation into play or air pollution mitigation. And part of this too is ultraviolet radiation, which I won't talk about today, but it's hard to not reduce UV radiation when you're also reducing heat from the sun. And so there's a lot of interactions between these two, but you can think about me looking at children's asthma or children's heat exposure or an outdoor workers heat exposure, or looking into the long term, what might the climate look like and how would that affect outdoor worker productivity? And so when we think about heat and air pollution as global hazards, both of them are silent. They're not going to bring a big storm in. They're not going to be very visible. Sometimes pollution is visible when it's coming from peat or forest fires, but oftentimes it's invisible to us standing at ground level. They're both slow moving and can hang around for a while when the right atmospheric processes are in play. But they're variable, and they're especially variable in how they affect people and who's exposed and who's not exposed and for what length of time. And both of them are deadly on a global scale. yet most of these deaths are preventable, which is I think is a good takeaway from a lot of my work. So when we think globally, premature deaths due to air pollution, quite large, and China and India pop out as important locations where a lot more pollution exposure occurs to people due to various reasons, whether it's indoor cook stoves in India or a lot of coal-fired power plants in China. And this is just from a recent 2020 report in the Lancet Countdown, looking at these statistics. And this is just per year, but we do know that the number of deaths based on the global burden of disease is quite high for air pollution. It's the 4th ranked cause of death globally. And again, you see China and India pop out there, but the US is still pretty high in terms of deaths due to air pollution. So overall, 9 million people, premature deaths occur per year, and this is from the recent Lancet Countdown on this as well. There's other scary statistics, but a lot of these deaths, as you can see, are in low and middle income countries, and in a lot of countries where we don't have the best monitoring either. But we do know that pollution kills the most vulnerable. More people are exposed to pollution when they don't have adequate HVAC systems, or so we can think of these situations of people living in homes where they're burning and cooking in the home, and that can cause a lot of issues, of course, with women and children in these countries. And we did learn a lot about the overlapping impact with COVID and pollution this year as well, which I think really brought air pollution exposure to the forefront in the media. So a company I've been working with to understand and to start to collect data more at the person scale is Clarity. And you can get a sense for variability in sensors globally and variability in pollution. And so here's the map more live now. And this is showing as much as they can from their own Clarity sensors, as well as AirNow sensors or government sensors that they can get access to. So you can zoom in and start to see real level concentrations. And so I'll talk about this a bit later, but some of these sensors here are AirNow sensors, and some of these are Clarity sensors. So this is the Clarity node that I've set up as part of a project I'll talk about later. Another Clarity node, but then you can click on others and find our AirNow sensors as well. And so there's ways for people to begin exploring concentrations in the area from both the government monitors, but then monitors that we've been putting around at school. So when I zoom in later, I'll go back to that and we'll talk more about what we've been doing in that space. But just to give you a sense of the direction things are going is to more open maps of data for air pollution, and really being able to understand the concentrations and reasons, so they can overlay maps of where fires are occurring, and even they were able to relate some air pollution concentrations with COVID risk. So it's a really neat resource. And then going into heat, you see areas, India and China pop out again, but the US also has a lot of heat deaths due to heat per year. This is from the same 2020 report of the Lancet Countdown connected to climate and health. And so heat also comes out as a big concern. And a lot of people don't realize that heat is the #1 extreme weather killer in a lot of countries, particularly the United States. But there's interactive effects of heat and pollution. And this was really brought to the surface from the Moscow 2010 heat wave. But it was also extremely poor air quality, some of the worst air quality they ever had. And there were peat fires in the nearby forests. And so this is a picture from central Moscow, and 55,000 deaths occurred, but it's hard to know if that can be attributed to heat or air pollution, because respiratory deaths can be caused or exacerbated by both. And so in terms of trying to look at the interactive effects, it's tough to do. And there's a lot of cities that when there is a big heat wave in place, there's also a high pressure system in place holding that air pollution there, or there's also other cascading and compounding impacts, such as forest fires. But looking into the future, this is from a recent study, the overlap of extreme heat and pollution is growing. And we can think about some of the recent global cascading and compounding threats related to COVID, COVID, heat waves, and forest fires all kind of coming together to really increase the vulnerabilities of already the most vulnerable people. And so it's definitely an opportunity for cross-disciplinary collaboration in this space. But I want to zoom into Maricopa County and think about what we've been seeing in the last year in terms of heat deaths. So currently there's 207 confirmed cases of heat deaths, and there's 134 under investigation. So that's 341 potential heat deaths. The year before that, there was around 200 heat deaths. And so the year of 2020 was quite bad for heat deaths. And as I just mentioned, vulnerability plays a really important role in that. And some of you have probably read this study that was published a few years ago before I was here, but by people involved in CAP and people who are interested in understanding, is it the actual temperature level that's most important to the number of deaths that can be attributed to heat, or is it to the vulnerability? And the simple answer is, in the 2016 case, where temperatures were lower than normal, there's a spike in heat-associated deaths, and they could relate that to vulnerability. And so that kind of thinking and understanding the wide-ranging variability of the human body and humans in general is what motivates a lot of my work to better understand the impacts of extreme heat on people. And so we can think about outdoor workers, elderly, pregnant individuals, and we know that the way heat affects these people is going to differ, but we also know that the actual exposures to people will vary by where they live based on their culture and their clothing, their demographics, and what kind of adaptive capacities they have. So I'll be talking about a lot of that today. Even the climate, a big theme of my research over the last couple of years has been understanding the difference between a very hot and dry climate versus a very hot and humid climate, and how that causes solutions to a lot of the heat challenges to differ as well. But one of the main messages that gets back to that vulnerability portion is that the impacts of these exposures are very unevenly distributed across populations, both globally and even when we look in our community here in Phoenix, Tempe area. And so this conceptual pathway of heat exposure was actually created in an article led by Evan Curis, who I believe was a CAP REU student quite a few years ago. You'll see there's other ASU faculty on there, Ari Medell and Dave Handula and myself. But we were really pushing past this, thinking that, okay, whatever the airport says is what people are exposed to, and that's kind of how epidemiological models are ran. But we know that's not true. We know that right now, a lot of us are sitting inside, and it's probably 75 degrees Fahrenheit, and we're comfortable, whereas outside, that is not what people are exposed to. And so thinking about then what can lead to personal heat exposure gets complicated, but important to understand how built an environment affects that. And you can think about the urban heat island, and where has vegetation and where does not have vegetation, where is shade present, what other behavioral and social factors are at play, and how can those differ. We know that those had to differ a lot during COVID, and still do in terms of people being able to seek cooling. And those two things definitely affect your exposure, whether it's outdoor or indoor environments. And then we can think about the public health systems or the interventions that come into play. Again, cooling centers come into play here, and other supportive systems that can keep people safe from experiencing overheating, essentially. And so those can lead to personal heat exposure, and the way people experience their own personal heat exposure can change based on their own physiologic susceptibility, which I'll be talking about in a minute. But if we think about someone who's less healthy or not acclimatized to the heat, not used to the heat, that can increase their risk for thermal discomfort and adverse impacts. And so when we think about personal heat exposure, we're thinking about that combined environment, radiation, temperature, humidity, and wind speed, and how do those come together with your own factors that can increase potentially your core body temperature or your perceived discomfort. And so the way I look at a human body and how we're experiencing the environment, you take into account all of those different streams and energy fluxes to and from the human body. And we can kind of combine those like a bank balance and take all of those equations and try and get estimates for what someone's experiencing. But when someone is exercising or working hard, that metabolism increases, and that is actually the most important factor often in predicting heat stress. And so that's exertional heat stress versus the classic heat stress that someone might experience if they're alone in a hot apartment, not moving, and experience heat stress or heat stroke. So they're two very different things, and that metabolic rate is extremely important to account for, which is often ignored in models. When we experience that feeling of a convective heat oven in Phoenix, so that convection can be away or to the body. In Phoenix, when the temperatures rise to above 100, let's say, above skin temperature, then that convection becomes a gain to the body. And then if we think about a really humid place like Houston, if it's too humid in the environment, then sweat evaporation goes down. And under these hot conditions, evaporation of sweat from the human body is the most important factor to reduce heat or not overheat in the body. And so we can take all of these algorithms and make an assessment of, is somebody experiencing compensable or uncompensable heat stress? So we look at the evaporative requirements. How much does someone need to sweat to get into an energy balance or have a balanced budget? And then what's the maximum capacity of that environment to allow them to sweat? And if that's greater than 1, it's uncompensable, meaning there's a potential rise in core temperature, and that's when conditions can get dangerous. If it's less than 1, it's compensable. You shouldn't be rising in core temperature, but you still might feel pretty hot. And so we can use that kind of thinking around these rational energy budgets to try and predict what people are experiencing in a given environment. And the thermoregulatory response to the heat is quite complex. This image is from a paper under revision forthcoming in the Lancet with colleagues globally. But in essence, when we think about what's increasing someone's vulnerability to heat, or what happens when you're overexposed to heat, your heart starts pumping harder because it's trying to get hot blood to the skin, so you can lose that through convection. But your core temperature can start rising and signal some of these processes to occur. So pumping more blood, so heart rate increasing. This is why you see more cardiovascular deaths in the heat. And then that's also, so it can signify more sweat. So you start sweating, which is good, but then you can become dehydrated. And when you become dehydrated, it's also harder to pump that blood around. And so the systems all work together to try and keep you in homeostasis or thermoregulate your body. But the body can become in disequilibrium, and then your core temperature can start rising, especially under those uncompensable conditions. So all of this is important to understand who's vulnerable and why someone's vulnerable. So older adults can't sweat as much, so that evaporative heat loss is not as present. Comorbidities can affect this thermoregulation. So thinking about people who are already ill with kidney or heart disease, medications that you take and alcohol or drugs also affect thermoregulation. There's still a lot of studies being done on pregnant women. Of course, some people it's hard to study because it's dangerous to study them in this capacity, where you're putting them under hot conditions and seeing how the body responds. So there's less studies on pregnant women and young children. And then outdoor workers in the heat have been studied quite a bit to understand how the heat affects their overall productivity and their ability to actually work. We do know from other past studies, it's very well known that social isolation is a big risk factor. And so you see a lot more cities doing knocks on the doors to check on people, or making sure that people have a connection if there is a heat wave or if there is a brownout or blackout. Not being acclimatized is a risk factor, which we can definitely, everyone can physiologically try to achieve, but it's most important in people like outdoor workers and athletes in the military to make sure they're acclimatized. But overall, the message is that the human body is complex, and who's affected by heat definitely varies, and it's always hard to predict. But when we do look at what the statistics show epidemiologically, these populations tend to pop out. And so if we zoom back into Maricopa County, thinking about what's happening, who's suffering, we know that those over 50 years old are pretty at risk. We know that men are more at risk than women. I think it was 74% of the deaths in 2020 were men, and most men die outside, whereas most women die inside. This 40% statistic is from 2018. In 2020, this I believe it was around 18 or 19% of all deaths occurred indoors, so lower. And then we do know that it doesn't have to be extremely hot outside for deaths to occur, and deaths can occur when temperatures are lower. And so these are important factors to consider. So when we think about some examples of social vulnerability, and a lot of this kind of thinking and these statistics and these stories help motivate my work, we can think of a woman named Stephanie Pullman, who passed away a couple years ago in 2018 on a 170-degree day. APS cut power, and she didn't live. So some of you might have heard this in the news because there's been a moratorium on shutoffs since then. And she had paid half of her bill, but she couldn't pay the whole thing, and her daughters didn't know. Her daughters were up in Ohio, and so the 72-year-old woman died alone in her house because she couldn't pay about $30 of her bill. So there's been a moratorium. This is still on, where between certain months of the year, you cannot have utility shutoffs. That doesn't mean that people don't have to pay it afterwards, though. They still end up having to pay their bills later, and so that's still a lot of money that people will owe. So this is an ongoing issue with the Arizona Corporation Commission that there's quite a few experts at ASU involved in, like Melissa Guardaro and Dave Hundula. A lot of my work also focuses on athletes and understanding what would make an athlete more vulnerable. Since 1995, approximately 3 football players on average per year have died of heat stroke. And all of these are preventable, but it's really important to understand what are the controllable factors that lead to someone so young and fit dying. And so actually, so just to kind of tell you about how Max Gilpin died, it was a hot day, and the coach said, we're gonna run till somebody quits. And the coach was being very hard on the athletes, and there's been a lot of court cases about this. Essentially, they ran until Max Gilpin could not run anymore, and he died of heat stroke. He was also taking Adderall and creatine, which the coaches and athletic trainers did not know. And there was no cooling tub on the side of the field, which if there's a cooling ice tub on the side of the field, that would save his life. And so there's a lot of efforts being put in place to make sure that this doesn't happen. And so I think a message from these two examples is that there's a lot that could have been done to prevent it, and that those factors, even though it's a hot day, controlling those factors would save a life, not necessarily turning the temperature down 1 or 2 degrees Fahrenheit, which is still important, but thinking about what's modifiable and not modifiable. So thinking about his body characteristics, how fit he was, if he was acclimatized, what kind of potential medications or drugs he was taking, can help limit this situation from happening. This problem with deaths in athletes has dropped quite a bit over the last years, but it's still a big problem, especially from an exertional heat illness standpoint, and so important to address. But hopefully I'm getting across this message that everyone's different, and even the most fit people can suffer. Social vulnerability comes into play, and so we really need to treat humans individualistically, and that's what I'll get into in a minute. But if we zoom out again, thinking about where is the globe at in terms of what's the media we're seeing when it comes to climate change and extreme heat. We see things like heat and humidity is at the edge of human tolerance earlier than expected, and deadly heat is forecast in the Persian Gulf, and it may be too hot for human survivability. And this heat is becoming more and more common. A lot of these focus on the hottest and most humid areas of the world, which do also have some of the most vulnerable populations in the world. But I'll kind of go through for you what the human models are showing compared to the climate models. So everyone's seen climate model projections, these nice spaghetti plots, and what they're accounting for is this variability in uncertain future emissions of gases and aerosols. They account for any limitations in the understanding of the climate system. They have different emission scenarios going forward, so RCPs. And so each source of uncertainty is quantified. It's very openly apparent. People can read about these and how they're quantified. If you think about how a lot of the studies that are being reported by the media are quantifying the human heat balance, it looks like this. So all humans will respond this way to heat in the future, or all humans will experience heat mortality at this rate in the future, and there's one type of human. And obviously, hopefully I've made the point clear that that's not the case and that everyone's very different. But just as a quick background, these studies use what's called the wet bulb temperature. So it's a really good predictor of kind of what you're experiencing in the environment. And it's the lowest temperature at which air can be cooled by evaporation. So the assumption of all of these studies that climate modelers are using is that at a wet bulb of 35 C, which is your average skin temperature as well, the body can no longer cool by evaporation or convection. And so you start to get into that uncompensable phase and heat up. It's a very conservative assumption and essentially saying that if you reach 35 C, widespread death would occur. But there's specific set of assumptions with this, that a person is completely sedentary, such as laying there, not moving, not wearing any clothes, heat acclimatized, an average size, usually male and adult, that has no thermoregulatory impairments, and that they're laying there for 6 hours. And so, of course, there's a lot of limits to that. And I feel so great that I get to work with physiologists and that I have some physiology background and climate background and understanding of the heat physiology to be able to address some of these issues and put forth some new ideas for how we can better quantify what humans will experience in the future. But this is just a projection of looking at current and then future conditions of wet bulb. And this F plot is based on RCP 8.5. And one thing I want to point out is that if we were to assume that wet bulb means 35, or wet bulb of 35 C means death, if you look at Phoenix, that means no one would ever die in Phoenix, which obviously isn't the case. I just showed you that over 300 people last year died of heat in Phoenix. And so it misses dry, hot conditions as well by using only the wet bulb temperature. And so if we try and account for other uncertainties, such as what model we're using, population diversity and adaptive capacity, then we're able to show it is a lot more complex than just that one simple line for a human. And so we can start to think about, are they exposed to sun? What are they wearing? Are they an infant? Are they a pregnant woman? Are they obese? Are they on medication? And then what adaptive capacities do they have? Because if someone is able to access water and cooling, or there's good heat warning systems in play to improve adaptive capacity, then the assumption of 35 is an over or an underestimation, or we're saying there's overestimations and underestimations of risk. And so we can over or underestimate what people are experiencing. But what we really want to do is take those weather conditions and turn them into what we know about heat stress. And so we can experience heat stress just by being out for a little bit, but the heat strain occurs when you start to experience heavy sweating and rise in core temperature and skin temperature. That's what would lead to a negative health outcome. And then that's what could help us understand if a future condition is going to be a livable location, a survivable location, a deadly location. So we can just start to look at these different population vulnerabilities across the lifespan and start to model this in our human heat balance models to project this into the future and say, okay, if body composition changes, what do we alter in the model to be able to account for that? If someone's on medications, we know that that decreases their sweat loss, so it's going to cause increases in their heat gain. Overall, climatization plays a role, and then the age is so important in terms of how it affects the convective and evaporative heat loss when you're over 65 years old. So it's really interesting, and in this Nature Communications article, we put together this figure to try and summarize all of these concepts together to show what other factors that we can account for in the future, both in physiological models and then thinking about those larger epidemiological models of a city. And so all of that kind of brought in technological and infrastructural and behavioral and physiological adaptations that we can better account for. And when we think about the adaptive capacity example, we had a study a few years ago, and Matt Georgescu was on this, who's on this seminar right now, look at what do we know about what models are showing for future and past heat-related mortality in developed countries. And so what we see is that the risk of illness or death in developed countries is projected to increase in the future based on assumptions around the human body's experience of heat and climate models. And so every prospective study indicates that. But if you look at past data from these developed countries, and I should say it's North America, it's in Europe and Australia, what we're seeing is that the heat-related mortality is going down. And that has a lot to do with adaptive capacity. So all these retrospective studies are reporting declining sensitivity to heat. So why the decrease? So air conditioning, heat health warning systems, education, interventions. Why the projected increase? Well, climate change, an aging population, urban heat, but we have to account for a lot of these other ways that people can adapt as well. What we do know is in another study I was on with colleagues at UCSD, the majority of studies that have been done on heat-related morbidity and mortality did find associations that were positive, but a lot of those are coming from more low and middle income countries. Yet very few low and middle income countries have been studied in this way because not much data exists. So it's an interesting conundrum to understand what we have learned and what we're doing a good job at, and what we can do a better job at as a globe to understand the heat illness and death challenge. So just a quick example of thinking about some of these indoor exposures. This is again from that Lancet article I mentioned, and what's happening within an urban area to try and keep spaces cooler, or what's happening within an apartment, let's say, to keep spaces cooler, and what's happening with solar radiation and convection if someone were in that apartment, and how we can reduce heat gain. But a local example connected to this is some work by Patricia Solis in the Knowledge Exchange for Resilience, where they're looking at deaths in mobile homes because the indoor deaths is a problem. And we know that mobile homes are pretty risky places to live. But one day Patricia was just doing some mapping and she saw that there was this huge gap in where utility assistance recipients occur. And she looked at where that was on the map and noticed it was a lot of mobile home places. And apparently, if you're in a mobile home, a lot of times with the landlord, you don't get utility assistance. And then you can start to see the number of indoor deaths that did occur in this area. So here, I think this is over in mostly Mesa area, a lot of mobile homes, a lot of indoor deaths, and very little utility assistance. So understanding what we can do to help those populations, and understanding just that indoor-outdoor heat exchange is really important. And then kind of one final slide on this topic that I find is really, really interesting to show, and I'll do some examples that would be local. But if you look at this plot here, we're looking at studies that have looked at conditions that have high humidity or low humidity and lower temperature or higher temperature. So Phoenix would be over here somewhere in general for most of the summer. And this is a study from my colleague Ollie J in Australia, looking at what could be a strategy based on the population that could potentially reduce thermal strain, cardiovascular strain, and dehydration. And so if we look at some of the examples for Phoenix, we can see that, and this is assuming no air conditioning, it's 46 degrees Celsius out, so that's going to be above 110 Fahrenheit, and very low humidity. If you self-douse with water and you're a young adult resting, it can reduce your cardiovascular strain and your dehydration because you're not going to need to sweat as much to cool off. Yet you're still losing heat from, or you're cooling your skin, so you're not experiencing that cardiovascular strain that's going to raise your core temperature. And so you could tell someone that here, self-douse, maybe turn on an electric fan. However, if you don't self-douse and you turn on an electric fan in Phoenix, it does not decrease strain thermally or cardiovascularly, and it does not decrease dehydration. Effectively, electric fans used in Phoenix when the temperature is that hot and it's not humid and you're not sweating can worsen the situation. That is not the case for more humid areas. And this lab has gotten the CDC and EPA to reverse some of their statements so that fans are used in hot, humid areas, but not suggested in hot, dry areas above certain temperatures. However, you can use fans here if you're gonna put water on your skin or wear a wet shirt. And so these are potentially life-saving adaptations that can be used if someone does not have air conditioning, which is really exciting to see, to give people other options to keep their core temperature down. So some quick takeaways from just that section is that survivable is not livable or even habitable meaning that you might be able to survive in a place, but that might not mean you can work in a place or reproduce in a place or be happy and live well in a place if you can't do much. Heat is complex, and the way we think about humid versus dry is different, and you often see it oversimplified in the literature if if the climate scientists aren't collaborating with the physiologists. And there's often a mismatch between the complexity that's involved in these climate models and human models and estimating those impacts. So I like to see where I sit is at this intersection between public health and physiology, atmospheric science, and sustainability. So I'm going to shift now to more local examples of some of this work and then get into local examples of air pollution. So this is a quote that an undergrad student received in studies a couple years ago, just thinking about how do kids experience heat here. And it's a lot of kindergarten students or teachers state, it's too hot to go out, it's too hot to play. And so knowing some of this and some of my other past work, it's important that we're starting to work with the schools to be able to figure out strategies to keep kids safe. It's also good to know what the Arizona Department of Health Services is finding for school-age children and when kids are visiting the emergency department room, if they're of youth age. And I work with mostly elementary school kids who fall with under 13 or 14 years old, and then you get into more the high school age kids, 15 to 18 there, which would be a risk, largely some of those exertional heat illness risks in athletes. But what you see is that there are a lot of emergency department visits, and these are costly. The average cost of an emergency department visit for heat is $5,000, and that's some of the work that CUR is doing as well. But I also am really interested in these often not studied impacts. And so this is a pyramid often used in public health research that looks at the environmental exposures. And then as you go up, fewer people are impacted. So fewer people are impacted by deaths and hospitalizations, but most people are impacted or experience the environmental exposure. Some people experience physiologic changes and effects that are subclinical. Some have to go see a primary care physician. However, within this space, I'm interested in how people might miss work or school, how lowered productivity could be factored in, any long-term issues that arise due to these exposures, missing class time or not being able to be active and things being canceled due to heat. Even poor behavior and performance in classes and understanding how teachers deal with that is really important. And heat also affects mental health. So there's a lot that often doesn't go studied, whether it's because we don't collect the data or death and hospital admissions is quite important. But if we can help people, prevent people from getting to the top of the pyramid by dealing more with these, then I think that would be a positive thing. So I'm going to give just some background on a local study at a school called Paideia Academies in South Phoenix. You can see there's a lot of ASU faculty involved here, Paideia faculty and ASU students. And this was one of the sites for our CAP field trip visit last fall. And so a lot of past work that I've done with a few people here at ASU looked at exposures to sun and heat and air pollution in playgrounds, what the child's vulnerabilities of those are, knowing that children are at increased risk for a lot of these due to different reasons, whether it's due to just inexperience or physiology, and that oftentimes heat or pollution risks don't get counted in what would be considered a heat or an injury in the same way someone tripping and falling or a broken bone would be counted. But heat illness is an injury that should be accounted for. And so when we think about modern schools and playgrounds, looking at some more artificial material use, low shade availability, often next to busy roadways, and they end up with less vegetation if so much artificial materials have to be used, and can be underutilized if they're not comfortable throughout the year. And so we started asking, how can we work with schools to increase shade, lower overall temperature exposures, lower pollution exposures, increase the overall greenness, and thus increase the utilization. So we're working with Paideia to reimagine outdoor play and learning spaces. And we call these natural play and learning environments as a place where children are surrounded by hills and gardens and trees and orchards and rocks, streams, caves, sundials, and other features that help kids learn and discover nature while they play and build social and cognitive skills. So it's quite exciting. Qingwen Chen won an EPA award for this work with her design studio, developing some of the ideas based on school input to make these designs happen. And so the construction is currently happening, but we were able to, our goals have been evolving with the school, but co-design goals with the teachers and with members of the school community to make sure we're achieving more of a holistic view of what a schoolyard can be used for. And a lot of my approach to this was to decrease heat and air pollution. And it's turned into lots of new studies looking at experiential learning, access to nature and food, and a healthy environment, and using innovative methods and tools for outdoor learning and play. And so some of the plans are starting to get put in place. The terrace campus over here, the director is putting in a full area around it called a desert botanical garden walkway, essentially for all the community to use. We've put in a Lear garden, which I'll show you in a minute, and just a lot of hedges and greenery, and throughout the school to achieve a vision to just focus on that latent ecological potential of schoolyards that are healthy and comfortable and safe for play and learning. And this has become a much bigger deal during COVID so that kids can still learn outside in safer environments that are less crowded. And it's also really highlighted that schoolyards often go unused for a lot of the day and year, and we're hoping to increase the amount of use they get by creating more shared spaces and focusing on a model like that so the community members can use a greener environment if they don't have access to a public park. So we've been doing a lot of microclimate monitoring of temperatures and humidity and different radiation values throughout the last couple of years, and that'll be ongoing as the redesigns take place. And we've also been doing air quality measurements throughout the campus. So we currently have 7 air quality sensors and 7 or 8 weather sensors throughout the play areas in the campus doing this pre-monitoring. And as these designs get implemented, we'll be able to see what that intervention meant for potential reductions in heat and sun exposure and air pollution exposure. And this school is next to Baseline, so it's quite a busy road. One quick note of success, I mentioned the Lear garden. We've been able to implement this garden since last March, and they're using it for curriculum already. Kids are able to go out there and work with the plants. And if you watch the CAP video, you get to learn about how the fish and chicken are embedded into this whole ecosystem, and the kids just love it. So it's been really exciting. In April, I mentioned the tree planting that occurred. So we planted a whole bunch of trees in this area to help cool it off even more. And so we're really interested in understanding these co-benefits in the renaturalization of outdoor play. Some of these potential co-benefits we understand already. Some of these we're still studying, such as social cohesion and connectedness with some faculty in the College of Health Solutions, hoping that we can reduce irrigation needs if we're able to keep it cooler in the overall area, understand how this might affect student achievement or their ability to learn different lessons outside the classroom in a more experiential way. So there's quite a few different things here that we're quite excited to study over the next few years. And then last quick local study I wanted to mention is an air quality monitoring project in South Phoenix with Marta, who's on the call here. Monique Franco is part of this because of the RET teacher connection. The Sunland teacher, so Natasha, and I forgot to write Sarah Rojo. And so as part of this project, we want to use these sensors to provide more actionable, accessible data in real time to community members. And with the CAP RET program, their question is looking into how do natural events and human activities affect air quality at their school. And so we really are pushing this idea of data discovery, data use for those who can benefit most from it. And thinking to what's available often from regulatory monitoring which are important for setting regulations, but it's extremely expensive, and you get a lot of sparse data, and it's hard to manage it, and expensive to manage it. But of course, we have a lot of Maricopa County air quality sensors around that. Some will measure ozone and particulates. There's a few that do NO2, and it's a lot of times based on what your biggest air quality challenges are. The shifting paradigm in this space over the last 5 or 6 years has been to try to measure it better at hyperlocal scales, to manage it better and try and fix it. And so this is where this low-cost air pollution monitoring comes in, to have higher resolution air quality data that's more data-driven, and that you can be able to understand patterns a bit better. But again, this is non-regulatory, and you're not going to get you'll get closer accuracy, or you get close accuracy, but you're not going to get the accuracy of a $100,000 sensor. These sensors are approximately $1,000, but you can put more of them out. And so just a few of us are installations around, and you can see Natasha here and Sarah here, and they're implementing this into their curriculum, with this framework of knowing science to shifting more towards doing science and letting the kids play with the data. So there's a data dashboard. You can see a bunch of the sensors around the city. Some of these are regulatory, the squares. Some of these are clarity sensors. So we have just over 20 of them now out around the city. And the teachers are able to go onto the dashboard and explore the data, change the dates, look into, what was happening on Christmas here and on New Year's here, and use that as examples in class to get the kids to ask questions. And so I think they might be presenting this at the All Scientists meeting in May, but just a little glimpse into what they're able to do. They can look at the data on the dashboard and start getting the kids to ask questions about why did we see these levels over Christmas and New Year's? What other factors could have come in related to meteorology, human activity, so wood burning in the home and fireworks, and the kids are able to then explore what that means and start to look into what they're finding on the news, or they found some fun reports from Twitter from air quality meteorologists that Phoenix at that time had some of the worst air quality in the world. So it really helps the kids explore data that is meaningful to their lives. And so last thing, Marta and I are working on doing some focus groups of an open air quality dashboard on Esri with all of the sensors. So this is the first iteration, and this will keep evolving over the summer and into the fall with a capstone group of students we have to try to make a dashboard that's usable and actionable by community members, and also by teachers, so that they can use it in their classrooms depending on what grade level they're at. And so we've already been doing focus groups to get feedback about how we can keep improving it. And this time of year, I always have to do a public service announcement around pediatric vehicular heat stroke. This is work that Ari Medell, Nancy Sullivan, and I did a few years ago. That's an extremely important topic, an extremely sad topic. 882 children have died due to PVH since 1998, all of which, of course, are preventable. It's interesting that only 24 deaths occurred in 2020, and that's largely attributable to the fact that oftentimes the reason children die or are left in a hot car is because a parent is going to work and forgets to drop them off at daycare or school. So it's quite a sad situation. There's a lot that we can do about it. We can start to look at these patterns, but our study looked at how hot cars get, and does shade mean anything, and what happens to the core temperature of a child in these cars. And it gets a lot of media attention, but most importantly, it helps support NGOs and nonprofits that can make change and make policy change in Congress. It's, I think, important just to know, if you see a kid in a hot car left in there, either forgotten or left on purpose, or maybe they gained access by accident and locked themselves in there, which is also a common cause. The first thing you do is call 911 and you get them out of there right away. And you are allowed to do that to save a child's life. So I always like to mention that. I don't think there's any heat deaths so far due to that this year. So just kind of takeaways, all of this is problems that should be dealt with now, and we shouldn't leave them up into the future saying they're climate change problems. Climate change can exacerbate these problems. However, they're already problems now, and it's time to start working on them and figuring out ways to minimize or adapt. Livability is important to consider in terms of how we are dealing with public health and well-being around heat and air pollution, but vulnerable populations are vital to think about, and economic viability is a part of that story too. And the Nature Conservancy is doing a study on this related to heat and air quality that I'm excited to see, specifically from Maricopa County, I believe. So with that, I'd like to say thank you, and I look forward to some questions.
Awesome. That was a great talk. Thank you so much. Yeah, so we have time for questions. Oh,
Question. Oh, Nancy and David.
Sure.
Yeah. So, Jenny, great talk. It's
Thanks.
really fun.
Good to see you, Nancy.
Good to see you. I was just gonna mention that, so one of the guys we worked with who does this sort of projections of future extremes, Ken Kunkel, at NOAA and NC State, he had done an analysis that was really quite interesting of what the heat risk is associated, or I don't know what metric he was using, but it was something associating by putting together humidity and temperature as two factors that are really, really important in terms of, well, thermal comfort and risk as well, I guess. And one of the things that I think he said was that, you know, right now, of course, Phoenix doesn't, you know, we don't see, even the projections for Phoenix, it doesn't really become important. This humidity factor doesn't become important. But in other cities, it's really important because I guess what they were doing was estimating, you know, kind of an estimated, what the temperature that you feel.
With the heat index?
Yeah, with the heat index, right. And, but it was really interesting because I believe I recall that what he was showing was that, you know, for right now, the places that are really have a really high heat index because they have high humidity and high temperatures, or, you know, places like New York City and so forth. But that it's actually going to become more important in Phoenix in the future because of, you know, temperature increases, but also expected increases in humidity. So I just wondered if you, because you were talking about the dry cities versus the wet cities, and if you had any knowledge of that phenomenon.
Of just the into the future, if humidity.
Just this idea that that there's a greater risk associated with the rising humidity coupled with rising temperatures.
Yeah, I've definitely seen some studies that are looking at that in terms of what will humidity mean in the future versus even temperature, and how that varies so much by location in the world. And it's really important. I think the way the models are ran as well matters in terms of what's being projected for how much vapor will be in the atmosphere over this location in the future, throughout a day or the evening, or the day and evening, which also affects diurnal variation and potential death rates in a city. But yeah, I mean, the heat index is helpful, I think, more as a tool to communicate with the public. We don't use it in Phoenix because oftentimes the heat index reports lower temperatures than the air temperature. So when you go on to, so when you go onto the heat risk tool that is used, and our great Phoenix NWS folks have developed this, it's using the air temperature because that's more of a relevant metric for people in Phoenix than the heat index is. And the heat index has its own issues. It assumes everyone's in the shade and walking at a certain speed and wearing the same clothing and is a man who's 35.
Well, but I think it would be interesting. I'll see if I can get a hold of, you know, if he's published it yet, but I'll see if I can get a hold of that, because what was interesting was this sort of flip where Phoenix did not come out as being as, you know, affected by this, but then at some point in the future, there's a projection that it will become more important as a factor, that humidity coupled with temperature will become more important as a factor in feeding.
Well, yeah, and I mean, we can look at the monsoon season where then heat index does work better here because it is more humid, and we can kind of say, well, will Phoenix be more like that in the future if there's more vapor in the air. Yeah, I think I know that study, but he's probably got a couple now. David.
Yeah, nice talk. Thanks. I was wondering if you had any preliminary results or insights, especially about the playground design and the setup at schools. That was particularly interesting to me as I look for a school for my 4-year-old.
Oh.
But just,
yeah.
You know, are there things? Sounds like, you know, you're not finished yet, but are there things that you're finding, yeah, these are great characteristics of outdoor spaces, etc.
Yeah, for that project, there's a lot of thought. Well, we did a lot of preliminary data collection and then use that as well as community input to develop these designs. And of course, cost came into play. But what in our climate makes sense? What can we plant? What is going to do well? Where should we plant it based on building orientation, based on when the kids will be there? So the way you might design for a schoolyard will be a bit different than the way you design for a public playground, just because of the time use at these spaces, which is important to consider. And then how the school wants to use it for now, both outdoor learning and play, to increase its utilization. So a lot of these different factors come into play when we're thinking about thermal comfort in playgrounds. And I've done this work in Phoenix. And so for that school, I should say the construction has just began, and there's been a lot of delays due to COVID, due to costs, and then construction companies just not being available. They're so busy right now. And so it's been very delayed, unfortunately. So I have a lot more pre-data than I expected I would, but I guess that's okay. And so but we've also been collecting data on what the kids are exposed to, how the kids are using the space, how they perceive the space now. And so afterwards, we can do all of this again to understand their use, their own interactions, how they perceive the spaces. And it's fun working with some kindergarten and grade 1 on this. And then I've also done work for Health Canada in looking at what are the best ways to design for thermal comfort across 4 seasons. And that's going to differ as well, and what you can do there and what you need to think about there in terms of wind and cold versus heat and humidity and sun is different, and it's actually harder to achieve than here, but here we have much more extremes in the summer. So just, yeah, I'm excited to see results. I think, you know, I think what'll be interesting is to see how the kids use the area differently based on where shade is. We already see them being really like magnets to shade on hot days. And we have a lot of data on that now. And so how might that change in terms of how much activity they get if there's more shade in the space, so they feel more comfortable using more of the space? And we might only find that in the, you know, May and August and September months. But what we're also seeing is that those shoulder seasons for heat in the summer are extending out. So those impacts in the future could just be even bigger. And I always like to say that, you know, when you look at a lot of these modernized playgrounds right now, if you look at thermal imagery or some heat maps across a city, they often become urban, like mini heat islands within an urban heat island because of how they're designed. And if we can flip that on its head and create park cooling islands as schools and say schools should be cooler places than the rest of the city and should be supporting cooling, that would be fabulous. And it's been fun to work with the city of Phoenix on some of this as well, and partners like Trees Matter to get some of these trees planted. Yeah.
Cool. Well, unless anyone has any burning questions, let's thank Jenny again. It was a great talk.
Yeah, thanks for the invite.